Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. Apologies for the delay. With us is Dr. Dina Henshaw, Alberta's Chief Medical Officer of Health. Dr. Henshaw will provide a brief update and we will open the floor for questions. Sorry.
Thank you, Shireen, and good afternoon, everyone. Before I begin, I want to note that the weekend data were uploaded onto the website yesterday, so today I will report on the last 24 hours. However, I do want to comment on a number of developments over the weekend. First, I want to offer a short explanation about a data system upgrade that happened this weekend, resulting in the erroneous reporting of 74 cases as part of the case count for Friday, August 14th. Our teams have now had time to do the rigorous investigation of these 74 cases and have identified that these were duplicate reports generated by the data system upgrade. As a result, Friday's new cases stand at 103 rather than 177 as reported yesterday. I apologize to Albertans for this error and any confusion or anxiety it may have caused. A positive development in the past several days is the end of the outbreak at the Misericordia Hospital, which was declared over on August 14th. That hospital is implementing a phased approach to return to normal operations. Some other developments that I want to flag are the quick actions of Covenant Health and Alberta Health Services to respond to a situation where a staff member tested positive over the weekend at the Grey Nuns Community Hospital in Edmonton. The staff member had been working on a unit that was caring for 3 people who had tested positive with COVID-19 acquired in the community, not at the hospital. Covenant Health closed the unit to patient transfers and discharges, took additional patient precautions, limited visitors to exceptional circumstances only, and has been performing enhanced cleaning. Other developments over the weekend arose out of a religious gathering in the hamlet of Deadwood near Manning and north of Grand Prairie, and a second development at the Bible Pentecostal Church in Edmonton. The It Is Time Canada religious gathering in Deadwood took place over the August long weekend. This is a good reminder that identified cases often are the outcome of activities that happened up to several weeks before. The gathering resulted in 15 lab-confirmed cases in Alberta and 17 in British Columbia so far, and it is likely that we will be identifying more. An estimated 200 to 300 people attended over the course of the 3-day gathering. We are working with BC Health to ensure that contact tracing is completed for all those who attended. I want to ask that anyone who attended the event in Deadwood between July 30th and August 2nd, or who was a close contact of someone who did attend, should book a COVID-19 test online through Alberta Health Services and continue to monitor for symptoms. Also, in an unrelated event, despite precautions being taken during in-person services, there are now 15 confirmed cases linked to the Bible Pentecostal Church in Edmonton. The church has about 150 members. Anyone who attended the church between July 26th and August 12th, or who was a close contact of someone who attended, likewise should book a COVID-19 test online and continue to monitor for symptoms. It is a stark reminder that coming together in large gatherings risks sharing more than fellowship. It risks sharing the COVID-19 virus. It is critical to not stigmatize those who test positive or those who have come in close contact, as we do not want to discourage people from being tested. Instead, we need to take this as a reminder that all of us have to follow all measures tenaciously, even if we are tired of washing our hands, wearing a mask, and not being able to hug the people we care about. We must all keep following public health advice if we are to continue to flatten the curve and protect our friends, families, neighbors, and communities. Turning to today's numbers, we identified 89 new cases in the last 24 hours. There are now 1,169 active cases in the province. Currently, 48 people are in hospital, including 11 in intensive care. Tragically, I am reporting 1 additional death today. My heartfelt condolences go out to anyone who has lost a loved one whether to COVID-19 or any other cause during this pandemic. The lab has completed more than 8,000 tests in the last 24 hours. We expect to add thousands of tests to this total this week and next. Alberta's 90,000 teachers and school staff working in schools have been invited to get tested before the start of the school year. That's a lot of tests in just a few weeks. So I'm very pleased to announce that Shoppers Drug Mart and its parent company Loblaw Canada are taking on an even bigger partnership role in offering testing in communities right across the province. More than 50 Shoppers Drug Mart locations and pharmacies in Real Canadian Superstores already offer asymptomatic testing. Under a new agreement with Alberta Health Services, within the next 2 weeks, all 234 Alberta-based affiliated pharmacies in Loblaw-owned stores will offer COVID-19 testing. The Loblaw family of stores includes such familiar names as Superstore, Wholesale Club, Extra Foods, No Frills, Independent, and Loblaw City Market. Thank you to Shoppers Drug Mart and Loblaw for making testing highly available in every community, including, and maybe especially, outside of the big urban centres. Overall, it increases Alberta's testing capacity by about 3,000 to 4,000 tests a day. That would serve half or more of Alberta's teachers and school staff. We will need this added capacity, plus that of all community pharmacists who are already testing for COVID-19, if we are to test these 90,000 teachers and school staff in just a few weeks. With that in mind, I repeat my request to teachers and school staff to book your test now and do not leave it to the last minute so that volume does not overwhelm the system. I also repeat my request to anyone who does not work in a school setting, who feels completely well and who has not had an exposure to COVID-19. Please hold off getting tested until later in September. For children, testing is only recommended if there are symptoms or a medical condition such as allergies that can mimic COVID-19 symptoms. Parents need to arrange testing for these children through Alberta Health Services. Pharmacy testing is only for those with no symptoms and no known COVID-19 exposures. Testing for anyone who has symptoms or known exposure to COVID-19 must be arranged online through Alberta Health Services at www.ahs.ca/COVID. You cannot go to a community pharmacy for your test. Thank you to Shoppers Drug Mart and pharmacies and Loblaw stores for stepping up to help test the educators of our children. Thank you to all the community pharmacies who are already providing this valuable service to Albertans to support our COVID-19 surveillance. And I invite all remaining community pharmacies to consider joining in offering asymptomatic testing through the voluntary pharmacy testing program. For Albertans who are wondering if their local pharmacy is providing testing, you can go to the Blue Cross website and check to see which pharmacies in your area are providing testing at this time. The knowledge we gain from testing will inform future pandemic-related public health decisions and will be a foundation of learning for years to come. Testing is a powerful tool, but even more powerful are the other measures, such as staying home when sick, staying distanced from those outside your household or cohort, wearing a mask when you can't, enhanced sanitizing and washing hands to minimize spread. The best thing we can do to prepare for a safe re-entry to school is to keep our community transmission low. We are currently sitting at an average about 2 new cases per 100,000 population over the past week per day. This compares with average new daily case rates of over 25 per 100,000 in Florida, Georgia, and Texas, where school reopening issues have been identified. In fact, our average new daily case rates per 100,000 are lower than almost all of the U.S. states, with the exception of New Hampshire, Maine, and Vermont, which are sitting at approximately 1.5 new cases per day per 100,000. This indicates that we are in a different context than states where we are watching some of those issues take place, and we need to strive to make sure our community transmission is as low as possible. Together, we can minimize the risk to students and staff in schools and help our children regain this part of their normal educational and social development. For all of us, taking precautions is part of living in the new normal of COVID-19. And as always, we are all in this together. Thank you, and I would be happy to take questions.
And we'll go to the phones now. Operator, please put forward the first question.
Yes, thank you. The first question is from Lisa Johnson, Post Media. Your line is open. Please go ahead.
Good afternoon, Dr. Hinshaw. I'm wondering, this is a question related specifically to the Edmonton zone, and where the ratio of active cases to population appears to be quite high. Is there a threshold for how many active cases there would have to be in the Edmonton zone for schooling in these particular school boards to be scaled back to scenario 2, for example, or that you would possibly recommend that they delay opening schools, and how close are we to that number?
So as you know, there are, and as you mentioned, the 3 scenarios for school reopening, scenario 1 being the back to school fully in person, scenario 2 being splitting classes and having students alternate days in order to have smaller class sizes, and of course scenario 3 being fully online. We are looking very closely at experiences of other jurisdictions around the world and determining where case counts in the community reflected then in significant challenges in schools in order to determine what transmission level we would consider to be a significant concern enough to be able to recommend from a health perspective that we may want to shift a scenario. Ultimately, again, the decision of the Ministry of Education, but we would be making health recommendations based on what we're learning from other countries around the world. There is no fixed threshold at this time, but we would work again with the Ministry of Education, with individual school boards, and we are watching very closely the case counts in Edmonton. As you mentioned, it has crossed the 50 per 100,000 active cases mark. There are no additional public health measures required at this time in Edmonton. However, we are watching it closely, working with the city and local public health to make sure that we are doing everything we can to reduce the spread of COVID in that area.
Operator, please put through the next question.
Thank you. Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. This is another scenario question. If one student in a classroom cohort starts showing symptoms for COVID-19, will the whole class be sent home to self-isolate? And would each student's family also be legally required to self-isolate? And finally, if one of those students had a sibling in a separate classroom cohort, would that cohort also have to separate or rather isolate and on and on?
We are working on an Outbreak guidance document that should be ready to be released within the next week, and that will have very specific guidance for all of those kinds of scenarios. I know that parents, teachers, school staff want to have all of that specific information so they can be making plans. What I can tell you right now is that if you have one symptomatic child who is in a classroom, it would depend on when their symptoms started, whether they attended school while they were symptomatic. Let's say, for example, a child who is attending school regularly gets sick on a Monday morning and they're kept home by their parents, they arranged for testing, and let's say that test is positive for COVID, but if their symptoms started on a Monday and they hadn't attended school on the Saturday or Sunday, there would be no significant exposure in the school, and therefore there wouldn't be a requirement to isolate or quarantine close contacts. If, however, you had a student who was symptomatic while they were at school and they were sent home, the simple fact of symptoms would not require those in the classroom to be in quarantine or isolation. What would happen is there would be encouragement of the parents to have that child brought for testing. If the child tested positive for COVID, then that public health investigation would go into who the close contacts would be and whether or not, again, in that case, if the child attended while symptomatic, if there were exposures, and those who would be in close contact would be required to quarantine. So it really depends on each individual scenario, and that initial investigation about was the child in school while infectious, if they were, who were their close contacts, and then those are the individuals who would need to stay home, get tested. And you mentioned the sibling. Certainly if there's a sibling of a child who's a confirmed case, that sibling would need to be at home and tested, but unless they themselves were a confirmed case of COVID, then their class wouldn't necessarily need to be isolated.
Operator, put through the next question, please.
Thank you. Yes, Jeff Slack, 660 News.
Hi, Dr. Hinshaw. I kind of just want to follow that a bit. Would that mean that a school would have to be closed down if there were a certain amount of cases found in a specific class? And also, I just want to get your thoughts on the CBE and the Catholic Board in Calgary making mandatory masks to K to grade 12, and if that should, or if other schools should be also following that mandatory mask rule.
So the question about the number of cases it would take to close a school, it would really depend on, again, what the circumstances were. We don't have a specific number threshold. What happens with even a single case is that public health would be working with the school to identify close contacts and making sure that close contacts were staying home, getting tested. And if there were a significant number of close contacts, or if there were many cases, if it seemed like there were large-scale exposures or lots of spread, those are the kinds of things that would be taken into account. And it would be a joint decision to close an individual school between local public health, the school, the local school board, with discussions with the Ministry of Health and Education, because it really is, there's not one single threshold that would make that decision. It's a case-specific and context-specific decision. The question about Calgary Board of Education and Calgary Catholic requiring masks for all ages, what we've done in our provincial policy is we've looked at the evidence around masking, the evidence around transmission, and what we currently know with respect to COVID-19 in younger children versus older children. And our recommendation provincially is based on what we understand to be the best provincial standard. Individual school boards may be looking at their own epidemiology and their own circumstances. They perhaps know the children in their schools and behaviors and the capacity to wear masks or not, and making decisions based on that local understanding. And so that certainly is within the ability of school boards to make those decisions. And so that, again, is what some school boards like Edmonton and Calgary school boards have done. But it really doesn't change that provincial assessment that we've made of the currently available evidence and what we believe is best across the entire province.
Operator, please put through the next question.
Julia Wong, Global News.
Hi, Dr. Hinshaw. Just hoping to get a few details of the outbreak at Royal Food Products at Edmonton, when that was first declared, how many cases are connected to that. Also, in regards to Edmonton being a hot spot, what patterns are you seeing? You mentioned last week that there was household transmission. So again, is that young people going out socially and bringing it back with them, or people coming back from their workplaces and bringing COVID-19 back with them? Is it connected to particular indoor or outdoor events? Also, as you mentioned, the city of Edmonton is now under a watch, and I believe this is the first time that's happened for a large city. So what specifically are you watching for, and what options are available if the situation worsens?
The question about Royal Food Products, so that outbreak has 12 cases, 10 of which are active, 2 recovered. We'll have to follow up with the specifics of when that outbreak was declared. I don't have that information with me at the moment. You had asked about trends in Edmonton, where we're seeing transmission. We're seeing a mixed pattern. It's not that much different than what we've been seeing across the province for the past month or so, which is a bit of a mixed picture, 70% under the age of 40, many linked to either household transmission, social gatherings. I mentioned we do have one site where a faith-based group has had an outbreak. There have also been 2 distinct private gatherings, so private parties, one of which has 26 cases linked to it, another with 17. And so those are where we've been able to go back and link a lot of transmission to a single event. But there are other points of transmission where, again, it's not that many, but social gatherings certainly continue to be an issue, particularly indoor social gatherings. And we do have a substantial amount of cases where we are still working on the case follow-up with public health, and we don't yet have all of the details about where they might have acquired disease. So I anticipate that more information will be coming in the next week or so as we complete those case investigations. You've asked what trends we'll be watching for in Edmonton. I think that we had a province-wide wake-up call a few weeks ago when we were seeing high daily totals across the province. This may be Edmonton's specific wake-up call with respect to realizing that within these pockets of transmission, these social gatherings, that it's critical that each one of us thinks about our activities and thinks that COVID will stop with us. So the activities that we engage in, the behaviors that we do, we need to make sure that we are protecting those around us by not spreading or being in a situation where we could potentially spread COVID. We are working with the city, we're working with local public health. As we continue, as local public health continues these case investigations, and if there are particular patterns or particular risk behaviors, then we will potentially see if there's any additional work that needs to be done targeted to those. But for right now, again, much of the issue seems to be private gatherings, not so much businesses, but rather locations where people might gather in a social setting.
Operator, the next question, please.
Shannon Scott, CBC.
Oh, hi, Dr. Hinshaw. I'd like to go back to talking about the Calgary Boards of Education. When they announced that they were going to be requiring masks for all students, both boards made mention that this was because it really wasn't going to be possible to physically distance in their classrooms when they're full. And when you were with us last week, you said that you had not recommended class sizes, but instead physical distancing. So I'm wondering how you envisioned physical distancing happening in classrooms when they are full of students.
What we know from countries that have successfully reopened where community transmission has been quite low is that particularly in the primary school or elementary school ages, there hasn't been a significant amount of transmission even when distancing has not been rigorously enforced in those younger age groups. So if we look at countries like Switzerland or countries like Sweden, in Sweden, they kept their elementary schools open for the duration of their response to the pandemic. Elementary school teachers in Sweden had a lower risk of getting COVID than the general population, about a 0.7 or a 30% lower risk than the general population. And their class sizes were on average over 20, and they did not require distancing in that younger age cohort. So I think when we've been making our masking recommendations and our recommendations with respect to distancing, we recognize that in those younger ages it will be more challenging. And that's where we've gone with more of a cohort model, where we're recommending that that class be a cohort, and therefore you not have multiple classes coming together in a place like an assembly, and that each individual class would kind of be that group that would spend time with each other. So if there were an exposure, there are fewer people who would need to be quarantined. And also, as I say, we've seen from other jurisdictions that that younger age group does not seem to be as likely to transmit if the community transmission rate is quite low. So there are multiple factors to take into account, which is why the recommendations that we've made, again, have been what we've put forward based on what we've seen in other settings.
Operator, please put through the next question.
Matt Woodman, CTV Edmonton.
Hi, Dr. Hinshaw. I'm just curious. Sorry, 1 second here. I'm just curious. How bad does the situation in Edmonton have to get to re-implement some restrictions or scale back the reopening, similar to the way the reopening was kind of delayed in Calgary when it was worse down there early on? And yeah, that's my question.
So in Edmonton, we're sitting right now just over 50 per 100,000. And we have seen in many other places in the province that areas have gone into a blue watch level and have then come out of it again as they've been able to get the particular trends under control. I think it's too soon to determine whether we need to do any additional public health interventions in Edmonton. And again, there's not a specific number that we're watching for at which level we would implement more restrictions. As I mentioned, what we're seeing right now is really more social interaction, social transmission. So it would be difficult to know what restrictions we would impose that would be effective. What we're really doing is appealing to people to use the guidance that we've put out to implement that in their daily lives. And if we do see increasing trends of transmission, if we do see a particular pattern, if we see that a particular location or activity that could potentially be altered or restrained through some kind of additional measure, then we would consider it. But Until that point, right now, again, we're simply watching closely, working with the city, and working to determine if there are patterns that would be amenable to public health intervention.
Just a warning, we only have time for probably a couple more questions. Operator, please put through the next one.
Mathieu Goyer, Radio Canada.
Hello, Dr. Hinshaw. When you look at the numbers, specifically in Edmonton, does it look like the end of the first wave or the beginning of a second wave in the city?
I think that when we think about waves, again, it's hard to say exactly what the pattern will be, because if we allow spread to continue unchecked, if we don't collectively follow the public health guidance, then we could be seeing the beginning of an upward trend, which could move into a bigger wave. What we've seen, I will say, across the province over the past several weeks is more like a series of ripples in different areas of the province where case numbers go up and come down. So I will say that a second wave, a really big second wave, is not inevitable. And the shape of what that wave looks like, whether it's a ripple, whether it's a high peak, that's in our hands. And collectively, we can keep it at more of a low level rather than a tidal wave. So again, it's up to us and the behaviors that we choose to take. Because, you know, again, what happens in the next couple of weeks is all about the decisions that we make today.
Operator, please put through the next question. We'll try and squeeze in two more.
Yes, Eva Ferguson, Calgary Herald.
Yes, thank you. My question is also around back to school. Dr. Hinshaw, you've spoken a lot about cohorts and encouraging cohorts in the lower grades. But I'm wondering if you're concerned at all for older students, particularly high school students, where class sizes are typically larger and students normally have 4 different courses with 4 different teachers and 4 different groups of students. Are you concerned at all by the lack of cohorts in the high school environment? And would you have any specific advice for high school principals to reduce risk beyond just wearing masks?
With respect to the guidance that we've given from the health perspective, it really has been about following those basic public health measures wherever possible. And we've really been looking to then local school boards to implement that based on their knowledge of local context, some of the complications that you're describing with respect to the older students, particularly in high school. And so I think that's where we've not wanted to micromanage individual decisions that are based on a local school context and how that would look for implementation. So I'm not sure, you know, if individual schools are struggling and they're speaking with their school boards and they're not able to come to resolution, I guess I would recommend that they speak to the education ministry and that we look at whether there's ways to find resolution to those issues together. But ultimately, again, we haven't been in the position of micromanaging that particular local school implementation. So if they're not able to implement cohorts, distancing, and masking is not sufficient, again, we would be happy to have that conversation. But I haven't had a specific request for a particular context come to us through the education ministry at this point.
Operator, this will be the last question. Can you please put it through?
Gary Tate, Globe and Mail.
Hi, thanks for taking my question. Dr. After test positive, how long is it taking before a contact tracer contacts that person and then contacts that person's close contacts and so on?
Right now, we're working with Alberta Health Services to increase the speed with which notification of positive cases and contact tracing is happening. We've been working with Alberta Health Services to implement protocols so that positive case notification happens within 12 hours of the result being available. Sometimes, in order to get that positive case notification as quickly as possible, Alberta Health Services has been splitting up the notification call and the contact tracing call, so it can take a few days to get the contact tracing completed. I don't have the metrics with me right now. We can look into that and see what our current metrics are, but I do know that it is taking longer than we would like right now, and we are working very closely with Alberta Health Services to look at all possible avenues to shrink that time so that people get a call as quickly as possible to notify them they're positive and to complete that contact tracing as quickly as possible. So we can get you the current metrics. And again, I recognize that it's taking too long right now, and we're working on resolving that.
Thank you, everyone, for joining us. Dr. Hinshaw will provide the next update on Thursday.